Welcome to the O'Brien and CHS seminar series. I'm glad you were able to find us today, as we did switch to completely virtually so that we didn't all have to share our germs, just the reality of the times we find ourselves in. But it is an absolute pleasure to welcome Dr. Maria Santana to the seminar today. Dr. Santana is a health services researcher, person-centered care scientist, and associate professor in the departments of pediatrics and community health sciences here at the Cummings School of Medicine. She's also the provincial director of patient engagement for the Alberta Strategy for Patient-Oriented Research, and she's the academic lead of the Patient and Community Engagement in Research, or PACER, program. So no surprise today, that's what she's going to be talking to us about. She's going to be sharing the evidence related to public and patient engagement in health research and its impact on health services research and healthcare. So with that, Maria, I'll turn it over to you.
Thank you, Fiona, for the lovely introduction, and Mariko for organizing this, and for all of you to be here. I can see some of my students in the little boxes that I have in front of me. I hope that you like the presentation, because you probably have heard about some of these pieces already. I'm going to start with a land acknowledgement, acknowledging the traditional territories of the Blackfoot and the people of the Treaty 7 region in southern Alberta, which includes Siksika, Piikani, Kainai, and Tusina, and the Stoney Nakota First Nations, as well as the city of Calgary. We know that is also home for the Métis Nation of Alberta Region 3. So with acknowledgement, I would like to say that I have nothing to disclose, and that I would like to talk to you about just giving you an overview of PPE, of public and patient engagement, and why and how we engage public and patients in health research. How do we do that, and what impact may have at the level of health research, practice, and policy. So I'm going to start with a little bit of history in terms of the idea of involving patients and people, public in research, and that started in the UK in 1996, and it was supported. Well, it is established by the National Institute of Health Research, and the idea was to support active public involvement in the national health services, public health and social care research. And then in the US in 2010, and supported heavily by the Obama government, they developed the PCORI initiative, which was funded by the US government. And the idea was collaboration with patient caregivers and all beneficiary stakeholders. And then here we are in 2011, and in Canada, and the Canadian Institute of Health Research launched the Strategy for Patient-Oriented Research. And the idea was that this initiative will help the transformation of the patient role, from a patient participant to an active partner in health research. So with that overview, I think that I would like to start with some basic knowledge for all of us to be on the same level. So just a very brief definition of what is patient-oriented research, who is a patient partner, what is patient engagement, and how and why to engage patient partners in health research. So let's get started. So what is patient-oriented research, POR? So again, the Canadian Institute, the CIHR, defines it as a continuum of research that engages patients as partners, that focuses on patient-identified priorities and involves patient outcomes. And after we go through these definitions, I'm going to show you 3 cases that you can see how it relates to the definition of patient-oriented research, just to put it more into a context. So who is a patient partner? So is really the definition, the focus is a person that have lived experience on a health situation. And it could be, you can have the health experience as a caregiver, family member, or a friend, and more so a member of the public who engages in research in some way or another. And the member of the public comes because, we have communities that we're more at the level of the communities, but also because you don't need to be a patient, you need to be sick. You could maybe have an interest in being involved in quality improvement activities, in health prevention or health promotion, and that's where the definition encapsulates this aspect. And then what is patient engagement? So patient engagement is the meaningful and active collaboration. It could be at governance level, for priority setting, conducting research, leading research, and for knowledge translation, so dissemination of the funding. So why? So what we have now, basic evidence, I think that the evidence is growing by the minute, I have to say. But at the level of a research, in terms of benefit to the research project, is that improve the quality of the research design, wider impact and application of research findings, a better understanding of into the gaps and of priorities in the research areas that come from the patient partners, and an overall improve of research effectiveness. And we'll see some examples as well. And then at the level of patient, the benefit, we are, I just added a few, but they influence the questions that we research. That it facilitate the implementation of the research funding that are more relevant to them, improves outcomes and the quality of health research. So how do we do that? How do we meaningfully engage the patient partners in our health research projects? So this is a question that we've been asking ourselves for a few years now. And CIHR said, I think that we need to consider the 4 guiding principles of patient engagement that they're here. So mutual respect, support, co-build, and inclusiveness. And I'm not going to go in details through the definitions of that. I'm going to provide you with an example, a real example from our Alberta Patient Partner Council. And this is a paper, it has been recently published. And this is really the patient partners in our Alberta for Health Research Council, working with the patient engagement platform and saying, this is what we would like to tell the researchers, clinicians, and other stakeholders that want to partner with us in research. And so at the level of inclusiveness, what inclusiveness looks like to them. So, make sure that the diverse experiences and perspective are included. So try to include patient partners from a variety of backgrounds. Be aware of cultural sensitivity when you include patient partners that are not usually part of the research teams, and avoid tokenism. And tokenism has different forms and shapes. And they were referring to, be thoughtful when you invite patient partners to work with you. So what we've seen sometimes is like, oh, I need 1 patient for my grant application. Be thoughtful, why and what are the intentions, and build that with them, the relationship. But we talk about that. So then the council also identify in terms of support, said like, okay, so great that you invite us to work with you in your research project, and we're bringing all the wealth of experience that we have with the healthcare system, with specific conditions, so multi-comorbidities. But these are some things that you need to look into it, and it's support. So tailor support. So it's not a cookie cutter thing. It was one size doesn't fit all. So we need, some people may have some barriers to digital access or having even a computer to work with. Another piece is about compensation and reimbursement. So if you're including people that works, they have 2 works, so be conscious about it. And if they're missing work hours, so compensate for them. Or to other people may like just to be reimbursed by parking or gas, or, So have that conversation with them. In terms of sustainability, when you try to sustain that engagement throughout your research circle process, look at the motivations and the expectations and the capacity that these people may have on a regular basis. The council also in terms of mutual respect. So how do we see mutual respect, but how do they see the patient partners that these people had already experience in partnering in research project? And so they said, be aware of the role and responsibility. So be very transparent from the very beginning. What are the roles? What are the responsibility? How do we develop that respectful collaboration? What is the role of communication, and how do we plan to keep the communication going through the research project? And what would be the role? How do we share that knowledge? And so respect to collaboration, of course, a key piece to make sure that you show mutual respect, but that you are able then to co-build through that partnership. The communication and planning, they said, it doesn't need to be complicated, but having email address or phone numbers, having regular communications. In our experience, some of the patients that partner with us in research, they have even formed a WhatsApp group or a Facebook group, and they communicate and organize meetings by themselves and so on. Co-build, or something that we hear more often, I think, is the co-design term. It really, they highlighted three things. So building and maintaining relationships, tokenism comes up in this conversation as well, and evaluation. So if we are going to be all working together, so we're equal members of the research team, because, you think that we bring all that valuable knowledge and expertise to the table. Let's build and maintain that relationship. So how do we go around it? And again, one size doesn't fit all. Every team is different. The dynamics change. Engage patients as soon as you can, but there is not a rule of thumb either. I mean, like, this is what we are saying now. Yeah, we want to include you from the very beginning, and we'll see an example coming up. But sometimes it's more relevant when we have this conversation with the patient partners, it's more relevant for them to be engaged at certain stages throughout the process of the research circle. And then evaluation. They should be involved in the process of evaluating the project. And I mean, like, the evaluation is a different piece where usually the evaluation have seen like, let's evaluate the role of the patients in the research project, but we never evaluate the role of the researchers in the research project. So there is a tension there. So they said, let us be involved in that as well. So, okay, so that's here. This is just a taste of this work that we've done at provincial level. Albertans for Health Research is a council of patient and public, and they have a reach of over 4,000 people within the province, and we have people representing each of the 5 zones within Alberta Health Services zone, just to frame a little bit more. So we have people from rural and remote Alberta, from different communities, different backgrounds, and patient partners that had a lot of experience at governance level, and so on and so forth. So this is something that they're telling us that we should consider. Frameworks. Okay, so these are coming from the patient partner saying to us, these are things that you need to consider. Okay, CHR is telling us the 4 pillars, the 4 principles, and this is how we interpret it. And now we have a lot of questions around a framework. So what is the framework to support the involvement? And this is Trish Greenhalgh from the University of Oxford and her team. And this paper I highly recommended. She said, like, one size doesn't fit all, because it's very, very contextual. But one of the suggestions is that we could look at supporting the public and the patient public engagement throughout the research circle. I don't think I'm going to have time to go through it, but basically in each box of the research circle, there are notes for you to take into consideration when you're thinking about how to support that engagement at each step. So for example, at the level of design, so you clarify the research question and affirm it's important. And here there is like, you know, I can highlight that when we partner with patients, the research questions can be modified. It's usually modified, I would say. So but just for you guys to look at this and use it to support your engagement. Now, another question is, do we have an evaluation framework? So, okay, so we now know that there is no framework for supporting, but that we could use the research circle. But do we have an evaluation framework? So we engage, we do all this engagement, all this work, all this effort, and can we evaluate? What is the so what? And this is a work that we have done at national level with the sport unit at national level, and it's a CIHR funded work, and we are still working on it, so just stay tuned. But just to give you a taste of that, is that the idea was to bring together the patients, the community partners, the researchers, the health system leaders across Canada to create this evaluation framework. And I have to say that this is the protocol, but we have ticked the boxes that we were planning. And it's been extensive work when you look at how do we engage community partners in a meaningful way, right? And what are the health system leaders across Canada that we wanted to invite, and how that looked like. Then building the consensus, we finished the consensus and the prioritizing exercises already. But then, you know, are we engaging meaningfully people from our Indigenous communities, immigrants and newcomers, people with intellectual or physical disabilities, so people with lower level of literacy? And so a lot of work has been underway to address these pieces by working with experts in the topic areas and creating working groups. So stay tuned for the Canadian Evaluation Framework, and I'll be happy to present it in one of the seminars when it's ready, because tremendous work has gone into it. So now I'm going to give you a taste of patient public engagement, and I can see that there's some attendees that they already have experience on that, and that's great. So I'm going to show you 3 local projects. Local projects that they always that they have been supported by CIHR, so we have funding for the 3 of them, and that although they're local, we have the provincial teams, but we have national and international collaborators as well. So the Identifying Priorities for Cardiovascular Health was a project that we did a few years ago when we could all meet in a room, and this is a room in W21C, and it's published at the BMJ Open, and it was a grant that we got with, as a PI, with myself, Sandra Zelinsky, who is a patient partner, and Sonia Butalia, who is an endocrinologist, and then you can see the rest of the team there. And we had a collaborator from university, the University of Montreal, Nicolas Fernandez. So this project really highlights how we work together and how that has informed the transformation of practice, really. This is the group, so I'm pretty sure that you guys know many people in this picture. We have most of the patient partners, the ladies sitting at the front, and then some of the guys at the back, and a mixture of researchers and clinicians and the patient partners. And so what were the priorities? So the priorities were prevention and prediction, the use of e-health technology, transitions and continuity of care, access to care, patient experiences, integrated care, communication, engagement, patient engagement, peer support, and rare heart diseases, addressing that piece as well. So the so what from this project, I could say that is the development of, so these priorities really inspire a new bucket of research activity and practice within our institution. And one example that I think is really interesting is the e-health technology. One of the patient partners that has been working with us for a few years now, she has diabetes, and she and her group of patients network have developed an e-health solution to manage their diabetes. So that's being led by a patient partner. But I have to say that there has been other CHR grants submitted in terms of looking at prevention programs, as well as patient experiences, and I think a one on rare heart disease as well. Okay, so that's one example. The next one is a work that we have done in pediatric. This is a work of a PhD, one of my PhD students. He just finished, defended, Dr. Sumit Bele. And as you can see, we're having fun there. That was probably 4 years ago, I would say, yeah. So we have 5 dyads, so moms and their kids from different age groups. So the little one is 8 years old there, and the older one is 18, and she's now second year university and has been working with me as a summer student for the last 2 summers, I think. You can see we have a diverse, we have people from rural Alberta, we have people from different ethnic backgrounds and languages, and we try to be a little bit diverse when we put together the advisory, but what they did really was to help us to develop the Kids PRO program, which is a program that we implemented in the asthma clinic at ACH for Sumit project. Collecting patient-reported outcome measures and using the information at clinical care to inform clinical practice, you know, like care planning and shared decision making and so on. So how they did that? So the Kids PRO was a health information solution, just the idea of developing the platform where we could collect the prompts and then we'll, you know, be graphically represented, like the graphic representation that you have seen here for the pediatric prompt, the PIDS QL, and specifically this one is for ages 8 to 12. And so they help us to develop this, and this was implemented in the clinic. So we conducted two systematic reviews. In the systematic reviews, we have input from our colleagues in Amsterdam at the Children's Hospital in Amsterdam, who have been our collaborators from day one. And the information from the results of the systematic review were presented to the kids and the family, to the advisors. We shared with them the measures that we identified as potential ones, and they suggested using one of the measures that all that information was fed back to actually some of the members of the Connect Care team, sorry. They put together this video to explain to other kids what we were doing in the clinics. I'm not going to play this video because I have another video to play. And then they help us to develop the education materials for the healthcare providers. So how they wanted to tell the healthcare providers to use that information that came from them. It was a really cool exercise. And this is a video with Jackie and Sierra Coe. that they really talk about their involvement in the project, but also some of the impact they had at the level of clinical care. So it's a little bit over 2.5 minutes. So just bear with me. I hope that you can hear it.
Hi everyone, I'm Sierra. I'm from Canmore, Alberta. I'm 15 years old. I was diagnosed with asthma when I was 3 years old, and now a high performance athlete who is trying to pursue my goals of becoming an Olympic alpine ski racer. Hi everyone, I'm Jackie and I'm Sierra's mom. We have been a part of the Kids PRO ever since it started, and we help test and provide feedback on the eHealth platform, as well as helping create the logo through working with the rest of the team, as well as working with various different apps and designers.
One of the things that I also help with developing and providing feedback on the user guide.
One of the things we think is super important and honestly interesting about the Kids PRO project is it breaks the communication barrier between the patients, parents, and their doctor, especially with my family or me and my mom, for example. My answers on the eHealth platform were completely different than what she thought was appropriate answers about my asthma, which honestly just helps the doctor get a better understanding about the patient and who's coming into the clinic that day.
Kids PRO looks at the patient as a whole person and not just their asthma from when their last exacerbation was, what medications they're taking, but how asthma impacts their entire life, whether it be at school, at home, in social settings, with their peers, and so forth.
Another thing to add on to that is, for me, from an athletic standpoint, whenever I go into the asthma clinic, most times my breathing tests come back very responsive and positive, basically telling the doctor that I'm completely fine. However, when my asthma does get pretty bad, my breathing levels are only at 80% or so. That means that I can't train and I can't perform the way I want to, which is honestly super frustrating. And then also, a lot of times when you go into the clinic to see your doctor, you can't think about all these questions you have or concerns to ask your doctor right on time, and then you leave the clinic with all these unresolved issues, which basically kind of defeats the whole purpose of going to your doctor in the first place. So yeah, we think that Kids Pro is super beneficial and yeah, important to use. Thank you for your time. Have a nice rest of your day.
So, well, I don't have much to add there, but this is an example on how they saw their engagement and then the use of the health solution that was developed at the level of care for their asthma conditions. So now I'm going to show you another example. This was a project that we did with few of our friends, and Kimberly Manalili led the project. Kimberly was one of my PhD students. She's now a PhD. So she's now Dr. Manalili. So what we were doing, so we got a CIHR grant to develop person-centered quality indicators. And one of the pieces when we were developing the indicators, one of the questions was that, are we engaging diverse people, or are we just working with one group of people that is always the usual ones? And so we went on an additional project that is this one, and engaged Action Dignity, who is an NGO, and of course Alberta Health Services patients advisors. So let me tell you a little bit about this. So the question is like, why engage underrepresented people? And so, you know, the underrepresented and diverse communities in health research and policy is still a challenge. Basically, the barriers that we know that relate to abilities, the geographic location, the financial and economic aspect, the cultural and language, and the real racism, discrimination, and implicit bias to that. So what we did was to work with Action Dignity and use a broker model. So Action Dignity uses this broker. These were our partners. These were leaders that were well trusted within their communities. And they knew, barriers and some of the limitations. And what we did, we trained them how to conduct focus groups where they are present with them. Not that I knew much of Mandarin when the focus group was running or Arabic, but yeah, so the communities that we engaged were the most prominent immigrant communities at that time. And they were the East Africans, the Latino, the Filipino, the Syrians just arrived a few months or a year after that. The Southeast Asia, and then we had China as well. Am I missing someone? Well, then what it was super important is that so we engaged, these were our partners, the brokers were our partners in the research project. And we started working and developing the research project, and thank God they knew how to work with their communities, because we would have been at loss. And all the communication that they had was translated into English. So we had all that data available to us in English. The partnership was a really good experience to see Alberta Health Services, the Patient and Family Advisory Group, and then the Action Dignity, the brokers and the community collaborating with us, bringing that partnership. Through the work, they identify 6 priorities. So access to care, culturally accessible language, patient and caregiver engagement, respectful and compassionate care, patient rights and cost of care. And patient and caregiver engagement and respectful and compassionate care were addressed together. That they said that we should have bring them together. And then 4 and 5 were tied. Oh, and the cost of care. And the cost of care was interesting because some of these communities, they didn't know that in Alberta we need to pay for dentists, psychology, and ambulance. There was some data around ambulance as well. So in terms of knowledge translation, so how, when we see the circle, the research circle, and engaging patient partners through that, one of the last steps is the knowledge translation. So you want to disseminate that knowledge. So what we did, the findings for the focus groups and the priority setting were presented by the brokers that were our research partners at a forum that we organized with the support of O'Brien Institute and the Methods Hub at that time, in which we have as key provincial stakeholders in healthcare attendants and the Ministry of Alberta and Alberta Health Services, researchers, organizations. So it was a forum of over 100 people. And then 38 participants. So we have a forum that was like half a day. And then the other half a day, we conducted workshops that were these 38 participants in the workshop were a mix of all the attendees that I described there, and they were discussing one of the priority areas for improving person-centered care based on the priority areas that I showed you before. And so I think I have a picture here, that's it, yeah. And so these are some of in the picture is Kimberly Manalili holding the thing and me behind, and then the others are members of the broker, our partners in this project. For the priority areas, each group work on identifying opportunities and initiative for improvement, discuss considerations for implementing these initiatives, and assess the feasibility of making improvements given existing policies and resources. So how do we do that? I have to say that The findings from this research project inform the development of the indicators, of course, but also inform a program in Alberta Health Services working with the SCNs that is called the I Know Health Initiative. And we have continued to partner with Action Dignity and AHS. And you can see in that picture, Dr. Kwan, who asked someone to take the picture. Kimberly, Dr. Yu, who was the CEO of Alberta Health Services, and myself. So this is an example of the impact of working with underrepresented communities and the model of the broker that we took on. I don't know how we're doing for time. Mariko, are we okay? I don't have it. I can see the
Good.
time.
It's just it's 12:35. So
Yeah.
you're good.
Oh, perfect. Yeah. So we can chat about this. Yeah. So thank to everybody that is here. So our council, provincial council, the kids and caregiver advisory that we're still working with them. They're just members of the family, that's how we said, and the team members and the funding organizations, the CIHR and the Alberta Children Foundation, and our partners, AHS, the CNs with the AHS and Action Dignity. And thank you, all of you, and happy to discuss this. Any questions? I'm going to stop sharing.
Thank you, Maria. That was excellent. So please feel free either to raise your virtual hand or your real hand. I can see you all on my grid. So we open the floor to any discussion. Maybe while people just gather their thoughts, Maria. Oh, I don't have to. I'm all. Please go ahead.
Oh.
Hi, Dr. Santana. Thanks for a terrific talk. I'm a postdoc with Dr. Stelfox, so I'm very familiar with your work, and it kind of seeps into what I'm doing too. I was wondering if you had noticed during your time working with patient partners and working with the public that women tend to step forward a bit more to be part of these projects, because I was kind of finding that in my work. And if you had found that, what are ways that you suggest to mitigate that, to have a more representative, I guess, member of the public or patients as part of our work?
Yes, that's an interesting comment. I think that at the beginning, and when we started looking at engaging patients as partners in our research project, there was a lot of females that were, the demographic were like white females, well educated. And then that really raised the question of, oh my God, what are we going to do about it? And so we start talking to people, and we talk to males from different backgrounds. I mean, like, why is it you guys are not interested in this, and how can we involve you? And so it's just opening to that conversation and bring them in. So Anmol, I invite you to our Alberta for Health Research meeting. We have meetings every month with the council. And so you see how many men we have there.
Oh, terrific. That would be lovely. Thank you so much. I appreciate your opinion on this.
Yeah, and feel free to reach out, because I mean, like, if you're interested in engaging some of the guys, like, you can come and present your project, and then this is a provincial council, so with a lot of networks, we really facilitate the research partnership across the province. So yeah.
Absolutely, that would be amazing. Thank you.
Thanks for the question.
Sarah, please go ahead.
Moran. Thank you so much for the presentation, and I love a number of things within that definition of patient partner as somebody who is not a research participant but is there alongside the part of that research team, and also that idea of having community kind of brokers, people to go out into the community to increase the diversity. And I was just curious if you would like to talk a little bit more about kind of, perhaps there's a spectrum of partnership or power sharing, because certainly having patients in early and having patients set priorities, that some of that power sharing and again, having brokers go out into the community, you're going out into community tables rather than seeking people to come in. But that kind of tension between, well, it's still the organization or the grant funding that sets, will we involve partners and what research project we will do and how the approach will be. And I don't know, maybe there's a, we need a whole spectrum of words, because partner, the idea of partner perhaps could be so broad. So just if you could perhaps unpack a little bit about that power sharing in partnership through those projects.
Yeah, that's a great question. And that was the power differential is something that really have brought to the attention of we need to support these people, that they have a great lived experience going through, healthcare, like, their conditions or multiple conditions, and we need to learn from them, right? Because we don't have, many of us don't have that greatness of lived experience. So how do you break the power differential is really addressing support. So what are the supports that need to be in place, and how do you address that question, right? And so understanding their motivations to be able to sustain that engagement throughout the project, and what are the supports that you need to sustain it. But Sarah, is really about having a conversation with them. Is really about, I think that in health research, we're so used to patient participants, that you invite the patients, they sign the consent form and so on, that now swifting into, these are individuals that bring a different piece to the equation of our research project, right? And how are we going to be doing that? So the 4 principles that I presented and the comments that the Albertans for Health Research Council provided to us, I think that they're quite informative. And another piece, I think I said it, is that one size doesn't fit all. So frameworks on how to do it, really, it won't fit your research project probably, right? You will need to modify. And so then going again to the context and the importance of the context and understanding the people that you're going to partner with. So I know some of the research, I'm having trouble to engage the partners. And did you ask the partners if they had access to an email? Like we assume that people have resources available equally, and they don't, or that they're basic things that we need to talk to them about it. I don't know if I answer your question, Sarah.
Thank you. Certainly good returning to those principles and that idea that one doesn't fit all. And I think part of it is recognizing, of course, there is a spectrum or that need for tailoring. So thank you.
Mm-hmm. And in terms of the spectrum, I don't know how you interpret a spectrum. I mean, what do you mean by a spectrum?
Well, you could have partnership in terms of having a patient partner be there equal to a researcher, so receiving payment for being there, helping confirm what the research question is, what the PICO is, helping craft the results of the report, helping craft the discussion section. But that's quite different from being the primary investigator who chooses which project to pursue, who chooses which grant to go for, who chooses the makeup of the research team, and how in terms of, along that spectrum, do you put that priority setting perhaps back in terms of the community or the patients, and so I'm kind of interested in that, but I see this as a multifaceted discussion, and certainly returning to those principles will be helpful in that.
Yeah, that makes sense. Thank you, Sarah.
Deborah, please go ahead.
Yeah, good afternoon, and thank you, Maria, for all this. Constantly amazed at all the things you do, but But obviously, as you know, this is near and dear to my heart with the kinds of research we do. And I just wanted to springboard from the comment that Sarah was just making around that spectrum. And I know, Maria, you're familiar with this, but it's been interesting for me, I think in the last decade, I would say, I would say sort of experiencing the spectrum in the sense that I think it's right. Once you've drunk the Kool-Aid, and as I would argue I have probably, and see the power and the engagement of how it can work when you really do partner truly with patients as partners and partners in research, it's fantastic. And then what I know has sometimes occurred for us, Sarah, is that well, we think this is just great and this should always happen, but there's going to be a spectrum. And I think the idea is, and I know, Maria, you do all sorts of things with Alberta Spore Support, but there is this range. Some people do just want to comment on a poster or give input on the logo. I was listening, to the video, right? And that's fantastic. That's still really helpful. It's lovely to do that. And then there are people who basically really want to be in it, And so I think this is something where we can leverage that. And I think certainly in the SPORE grants, the Strategy for Patient-Oriented Research, Chronic Disease Networks, one of the things that I've enjoyed is if you can build up a community like Alberta, like you have in the SPORE unit, you can have that range. It's perfectly fine for all of those things to exist. It doesn't have to be one way. And I guess then the question, so I think that is a fabulous opportunity because, and you can think of it like in Imagine, we involve people in the governance, and we've done a whole seminar on this. We involve people in the research. We involve them sometimes just on the logos, and they choose, depending on their availability, their time, their commitments, where they want to be. And then, of course, at the extreme, we have the patient and community engagement research program, where that's probably like the real extreme. But the question then to you, Maria, would be, how do you manage within this large spectrum when you're primarily a researcher? So let's just put our research on. How do you manage that? Or when you're primarily a Alberta Health Services person, well, how do you navigate that? Because sometimes it gets a little confusing in figuring out what people want, and it changes. And when you're writing that grant, you're trying to deliver something, and it's changing. How do you manage that? How do you make sure that you can still deliver in the end?
That's a good question, and I'm asking myself every day about it, Deb.
What's the answer? Tell me what the answer is.
Yeah, that's the answer. That's the answer I'm asking myself every day. How can we manage this? But in terms of the spectrum, so if the question is like, we have competing priorities at our work level, and we do need to look at when we bring patient partners to work with us, we do need to carve out the time to build that relationship, that trust, that, the communication strategies, exactly what Sarah was asking in terms of the level of engagement. I mean, like, at what level would you like to be engaged? How do we tease out all that details? And the answer is, there is not a cookie cutter approach. It's a question of carving out time and saying, okay, I'm bringing patients to partner with me in research, and I know I need to have this conversation with these people. What kind of support they have? How would you like to be in communication? At what level of engagement you would like across the research project? Like, I think having that communication is super important to build a relationship and work together in a partnership. Deb, if you and I were going to work on a grant, you and I would go for a coffee, wouldn't I? we will go for a coffee and talk about, oh, I have this idea. What do you think about it? And we have a brainstorming. And then we'll call each other on a Sunday evening. I'm stuck writing this because I don't know. And you will tell me. So we do that really, really well among researchers and clinician researchers, but we partner patients and we don't partner with them to that level. And that's where they were telling us it's tokenism. It's just ticking a box and saying, I have a patient partner in my project. And so anyway, I'm going to stop here because every day I wonder about it. Are we there yet in that sense?
Thank you, Maria. Gina, please go ahead.
Hi, thanks so much. This has been great. I'm brand new to research. I'm doing my first year of my MSc, and I'm curious how you would suggest trying to get patients involved with a project where I haven't done research before, and I'm on a bit of a timeline too in terms of working on the master's program, but I'd be really interested to try to add that perspective. So curious if you have resources or ideas for someone really new.
Oh, Gina, I have a lot of resources to send you. So if you give me your email or send me an email, I will send you resources. The first step will be, like we have a certificate course ongoing that Alessandra Palucci is involved in that program. But I think that we have the unit, the Alberta SPORE unit. So I can send you details, specific details. We can talk to you. We have people that can sit down with you and can work through that with you. So we do have the resources.
That's awesome. Thank you.
I think, Maria, perhaps just recognizing, I think there are several students and emerging leaders or learners, including myself. So perhaps if you send that out, Mariko could send it to all the participants so that we all have the resources. So thank you. And
Thanks, Fiona. Yeah, that's a great idea.
all right. And last question over to you, Amal, and then we'll close off.
Hi, Dr. Santana. Another question for me, this is more for my own curiosity. So you work with a lot of different people in a lot of different disciplines. Where do you find that there is a large need for patient and public engagement? Like it's not very well integrated into that. It could be a clinical discipline or a line of work. Or where do you find that people don't really communicate to you from or reach out to you? Maybe a field that is less, receptive to patient public engagement currently.
Interesting question. And I think that I should say that we're proud to see how many clinician researchers in our province are engaging patient partners meaningfully in their research projects. More work to be done because we need training materials. We need to do this kind of stuff that we're doing now. We just launched a certificate, so it's quite new, the certificate. But I wouldn't be able to point out, a sector that needs more work on it. Yeah.
I understand. Yeah, I was just kind of curious. Like I see projects coming out of certain, I guess, clinical disciplines that are patient oriented more than other disciplines. So I was wondering if you had noticed a trend, or if it's something that comes to you in the future. I'd love to hear about it.
I think maybe I'll stop it there in case Maria's like, oh, I've read Dr. Clement's work and that's where the focus needs to be. We don't need that shared here in this forum. So with that, thank you everybody for your engagement and sharing your lunch hour with us today. Thank you, Maria, for sharing your wisdom and reflections with us. And I wish you all a wonderful rest of your Friday and a fantastic weekend. Our next seminar is on November 4th, and we're really excited to be welcoming the new sexual violence educator team to be sharing with us some skill building and some tips around what to do when you see something and you're not sure how to act or react in a safe way to yourself and in a safe way to the environment that you're in. So I'm really focused on building our skills in that area. So I hope to see you all there, and take care in the meantime.
Thank you so much. Have a lovely weekend.